Hi, friends. We've had yet another power-packed week of the Streams of Joy early morning prayers, and over the week we've had a few tongue-tying diagnoses which have been prophesied upon, and as usual we're going to go through a handful of them with the expectation of someone who's followed the program right from Monday up till Friday would pick on some of the diseases that we're going to be talking about, their symptoms primarily, and relating them to the diagnosis that was mentioned in the course of the week. So, jumping right into it, first we have pheochromocytoma. Now, this is a tumor of the adrenal gland. The adrenal gland is the gland that is responsible for adrenaline, which basically is called the flight or fright hormone. So, with this, you would usually have a raised blood pressure. You will also get constant or persistent headaches, and palpitations will also be a trouble for you. Now, this is very often a benign tumor, which means essentially that it doesn't really turn into anything fatal. But 1 in 10 people can have the cancerous variations. Now, other symptoms you can have with a pheochromocytoma is increased sweatiness, a pale face. You could be quite nauseous, and you find yourself being a very anxious or panicky person, and sometimes tremors, like a shakiness of your limbs. Now, for people who have these symptoms, you may want to do a urine test through the doctors, of course, and have some bloods done to clearly diagnose if you've got something growing in your adrenal gland. You would need a CT scan or an MRI. Now, these are not an easy target for normal, ordinary people to achieve, but there are people who follow these programs and who have had the symptoms, and they're wondering what exactly is going on with me. Now, it could be that you have been prophesied upon, but you haven't picked on it because you do not have a diagnosis. So diagnosis may be the first benchmark for your miracle. Now, for those who've had this diagnosis, management of it would require some tablets called alpha blockers, which essentially try to control some of the symptoms. The majority of it requires surgery to remove this abnormal growing gland, and some chemo and some radiotherapy. Pleural mesothelioma. I've had feedback from some of my friends who follow this episodes, and they say perhaps it's in my delivery. Maybe I should try to use a bit of my indigenous accent to reach the target audience. Now, it's difficult. I'm trying to balance both worlds, but I'm using words as simple as they can come to make sure it means something to you, even if the delivery isn't absolutely on point. But hopefully we can get better as we proceed. Now, we've had pleural mesothelioma. Now, this is a cancer of the tissues. Pleural means it's covering the lungs, so it's a cancer of the tissue covering the lungs, the lung linings essentially. So it happens for people who have been exposed to asbestos. So if you have someone who's suffering with a chest pain, difficulty breathing, a painful cough, weight loss, abdominal pain, find out in the history, or is it your history? Have you worked in somewhere in a factory, or in some, like if you've done some roofing job earlier in life, or you've worked in a coal mine where you're exposed to asbestos. Now, if you weren't, perhaps you lived with someone who might have worked in such facilities and had brought asbestos home, and passively you've inhaled this stuff. Now, this can or could have led you to having these symptoms. And where it's undiagnosed, it's difficult to place your disease and to get the appropriate treatment. So, beyond the symptoms I've mentioned, clearly weight loss, abdominal pain, and some swellings. You could have fever because indeed there's an inflammation going on, and you could have some lumps on the chest wall. So you have like sudden onset lumpy skin around your chest wall. Now, this cancer, this pleural mesothelioma, is more common in men older than 40 years. If you've got symptoms and you've seen a doctor history, and an examination can help guide what we're thinking about. A chest x-ray, absolutely spot on, a CT scan, or they could go in and take a tap of the tissue around the lungs and take it to the lab and see if it does grow any of these worrisome cancers. A lung function test is also extremely important as well. Now, if your occupation fits with the symptoms I've mentioned, and you've got, I repeat, a painful cough, difficulty breathing, you've got some weight loss, you've got lumps around your chest wall, it is expedient that you see the doctor. It is expedient that you have this test done. And if the diagnosis matches the prophecy, if your symptoms match the diagnosis and the diagnosis matches the prophecy, Rebecca, you've got it, spot on. So going again down the week, we had Barlow syndrome.
Barlow syndrome. Barlow syndrome. If you are the one, put it on the last one. The devil is a liar. Oh, your mouth, let it be reversed.
God deals with both the rare and the common. So Barlow's disease is another rare disease. It's a malfunction of the valve, a stretching of the valves in the heart. And someone who's got this would have symptoms like a racing or an irregular heartbeat. You would suffer from dizziness, like a fainting feeling, shortness of breath, and fatigue. Now, the risk factors, it's often an inherited disease, and if you have other diseases like scoliosis, now I'm going to have to mention big names because they're big name diagnosis, or Graves' disease. Now, we're not talking of diseases of the grave, it's Graves' disease for a reason, but it's mostly of the thyroid gland. And then management of this, we're talking of echocardiography, which is like an ultrasound scan of the heart. And then we have an ECG, which like putting some electrical wires around to look at your heart rhythm, and surgery to repair this valve. Again, if your symptoms, either as a young child or as a grown adult, if you have symptoms that match what I've just described, a racing heart, irregular heart, dizziness, shortness of breath, you will do yourself good service to have yourself seen by a medical practitioner. Still keep on with the faith, but if you know what you're suffering from, you can easily pick on your miracles. Now, the last one I'm going to talk about today will be the cancer of the omentum.
Right now, cancer of the omentum. If you are the one, put it on the last one. The devil is a liar.
A funny word, omentum, but what it means really is a fatty tissue covering most of the stomach and the intestines, and people don't quite know why it's there, but it does have loads of blood vessels, so it's highly vascularized. A cancer of the omentum is rare, oftentimes asymptomatic, which means it has no symptoms. Well, in occasions it does start to spread, or it could come from the stomach or from the ovaries, where you've got a large omental population. The risk factors: people who are older than 50 years, environmental factor, family history. You have that genetics does play a role here, and also lifestyle. So if you've got a history of smoking, alcohol, reduced fiber in your food, and sedentary means you sit around a lot, then you are at higher risk of developing omental cancer of the omentum. Now, the symptoms I'm going to talk about will be stuff like a new solid mass coming up on your abdomen from nowhere. You've got pain, you've got constipation, you've got easy satiety, which means you have a little food and you're already full, nausea and vomiting. To diagnose this, clearly the CT scan, you can never underestimate the importance of a proper scan. Look at the inside, see if there's any mass, and ultrasound before the CT if we're going up the ladder. Managing the omental cancer, we're talking about chemotherapy, radiotherapy as well, so a bit of radiation, some tablets, lifestyle changes, stopping smoking, eating the right thing, exercises, weight loss where you can intentionally target losing your weight. So if these symptoms match what you feel, if you've been believing God for your miracle following the Stream of Joy program and you haven't quite caught up with the diagnosis because you have not been diagnosed, this is my call to action for you. Go see a doctor, go get the elementary test done, be on that pathway, plug your faith into the prophecies, and help yourself to match your disease to your miracle. My name is Dr. Ojo Obiora. I'm a GP with a special interest in YouTube. If you've enjoyed this episode, I would implore you to please like, share, subscribe to my channel. We are essentially complementing what the man of God is doing, trying to make sure that people seek help for the symptoms that they have. People who are tuning into this program understand that diseases are medical, healing can be spiritual, but treatment again is medical. So a combination of all three with your faith will get the faster outcome. So share, subscribe, like, leave a comment. I'll see you again sometime next week when we do a roundup of this coming week's episodes. Cheers. Bye.